Hi, this is Dr. Nancy O'Hara, and welcome to the presentation. I'm very happy to be part of and representing Mind tonight, a wonderful organization that's there to help our children. Tonight, I'm going to be talking about It's Not Me, It's My Germs, how the gut affects our behavior and our neurodevelopmental problems that our children may go through. Things like anxiety, depression, mood disorders, as well as ADD, ADHD, autism, and OCD. So welcome to the presentation.
Welcome, everyone, and welcome to the Mind Forum Online. It's my great pleasure to introduce our speaker for today's very creative and important talk entitled, It's Not Me, It's My Germs. Dr. Nancy O'Hara has distinguished herself as a global leader in educating clinicians and a very experienced integrative practitioner in treating patients on the autism spectrum. Dr. O'Hara is a board-certified pediatrician. Prior to her medical career, Dr. O'Hara taught children with autism. She graduated with highest honors from Bryn Mawr College and as a member of the Alpha Omega Alpha Honor Society from the University of Pennsylvania. She earned a master's degree in public health from the University of Pittsburgh. After residency, chief residency, and general pediatric fellowship at the University of Pittsburgh, Dr. O'Hara entered general private practice in 1993 and in 1998 began her consultative integrative practice solely for children with special needs. Since 1999, she has dedicated her practice to the integrative and holistic care of children with neurodevelopmental disorders, ADHD, PANDAS, PANS, OCD, Lyme, and autism spectrum disorders. And she works at the Center for Integrative Health in Connecticut, where she's a partner. Dr. O'Hara is also a leader in training of clinicians both in the United States and abroad. And I'd like to add a special note that Dr. O'Hara is an important member of the Mind community. She was a keynote at the very first ever Mind International Forum in 2006 and serves on the Scientific Advisory Board of Mind Foundation. And more importantly, she was hands down my children's favorite clinician, in large part thanks to the very entertaining singing dog who occupied the lounge chair in her office. So welcome, Dr. O'Hara, and thank you for joining us today.
Thank you, Leslie. If everybody's not bored by all of that the credentials, we'll have a great hour of lectures. But thank you for all the kind words. And that particular dog is no longer here, but we have another one to entertain the children too.
Oh, brilliant! It's a good technique. Okay, over to you. Let's get started.
Okay, so it's not me, it's my germs. What I'm really trying to look at over the next hour is how our gut affects our behavior. And I'm sure Emerson didn't mean this when he said this quote, what lies behind us and what lies before us are small matters compared to what lies within us. But I certainly mean the gut. The gut is a very complex organ. As we know, when you spread it out, it's the size of a tennis court. The surface area is 300 square meters. And there are hundreds of trillions of bacteria that make up our gut microbiota. We are an ecosystem of immune system, neurons, and certainly microbes. So how would I know if gut dysfunction is affecting my child's behavior? Well, any of these could be signs that the gut is affecting your child's behavior. Difficulty breastfeeding, persistent colic, either longer than it should be in months or longer in the course of the day or more severe. Gastroesophageal reflux that's not just positional. Food sensitivities, not just allergies, but sensitivities. An insatiable appetite, that is often a sign of germ overgrowth. Where your child is eating and eating and eating, especially craving certain foods and not even gaining weight. Failure to thrive can be a sign. Frequent antibiotics change the bacteria, the good germs, the good flora, and increase the abnormal flora within our gut. Abnormal posturing, and I'll show you pictures of this in a minute. Hands in the pants, where they're probing in the front, putting pressure on their abdomen, on their bellies, or probing in the back and probing their anus. Both may be signs of gut dysfunction. any self-injurious or aggressive, agitated, irritable behaviors, and certainly sleep problems, especially those children who still sleep in the fetal position or those who are very restless sleepers. All of these children have gut dysfunction of one form or another. And as you can see, they're putting their bodies over the rims of things. They're curling up in balls. Their guts are in pain, and their agitation, their OCD, their anxiety, even their depression may be secondary to gut dysfunction. This is not a new finding. Decades and decades and decades ago, Hippocrates said, those who are mad on account of phlegm are quiet, but those on account of bile are vociferous, vicious, and do not keep quiet. Meaning that when it's the gut, it affects how we act. The physical exam is also a very important part. If your child has abnormal stools, these can be grainy stools that may show a need for taurine. They can be diarrhea, constipation, or what we call encopresis. First of all, encopresis is where we look like we're having diarrhea, but it's actually a large mass of constipated stool that we're pooping around, meaning the stool's coming out like liquid around a clogged pipe. Also remember, constipation is just not hard rabbit pellets. It can be any child or adult that doesn't poop every day. So if you haven't gone and had your stool today, don't leave in the middle of the lecture, but please remember to do it today. Anybody that's not stooling at least once a day and up to 3 times a day could be constipated. So please keep that in mind, and we'll talk about that more later. A wasted buttocks and failure to thrive, that distended, bloated, what I call the Pillsbury Doughboy abdomen, that doughy abdomen. Also, any signs of inflammation within the gut that you can find when scoping a child or that you may have heard that your child has. This is a child with a very bloated belly and also evidence of failure to thrive, the very thin buttocks. This child indeed has gut dysfunction. This child also has a very bloated belly, and if you can see it, there's signs of a yeast rash, a candidal rash, and we're going to talk about that more later. And then finally, this is all pictures of an abnormal esophagus, the ulcers, the mucus, the swollen glands that we see in guts of children with autism, as well as other problems. So let's look at the germs first. What can we see when a child has an overgrowth of parasites or Clostridia? These are children that may definitely be probing. Derek McFade did some excellent research in looking at Clostridia in children and found that Clostridia wants to be propagated outside of the gut. And so when Clostridia is present, a child is much more likely to itch and probe their anus and want to propagate or smear the Clostridia. I'm not going to get any more graphic than that, but I think you've got the drift. Any picking, biting, licking, grinding, or aggressive behavior could be parasites or Clostridia. So grinding could be butt grinding or teeth grinding. Also with yeast, you can see rashes like your typical yeast diaper rash. You can see peeling feet like athlete's foot, and you can see ridge discolored nails, which I'll show you. Also behaviorally, you can see anything, I always tell parents, anything that you could see a drunk do could be a yeasty behavior. So you can have a belligerent drunk, a silly, inappropriate laughter drunk, or a brain fog drunk. And any of those can be signs on history of yeast. Also, you can have inflamed cheeks on either end and a red anus. And then certainly ringworm on the head, on the body are signs of yeast. These are the nails. These are like your grandpa nails, you know, the commercials where they show those thickened, yellow, yucky nails. But these are also yeasty nails. They're starting of ridges, the start of discoloration, malleable, soft nails. These are all signs of yeast overgrowth. And there are lots of studies out there that show us that there is an association between anxiety and gut dysfunction. Those children with constipation had autonomic or the automatic nervous system dysfunction. So they were positively associated with gut problems and anxiety. We also see this with sleep. Gastrointestinal problems are commonly associated with sleep problems. And we see it with rigidity and OCD. Those with constipation are much more likely to have problems with OCD. This is a little boy, not who loved baseball. They put the baseball glove in his hand because he always had to wear a helmet. You can see that he has a very bloated belly. He also has some allergies, but he was a headbanger. And that head banging caused him to have to wear a helmet, but was from his dysfunctional gut. So anxiety, over-responsivity, agitation can all be associated with constipation, abdominal pain, bloating, diarrhea in children with autism, as well as other neurobehavioral problems. And this particular study by Tim Bowie at Harvard showed that children with aggressive or self-injurious behavior were more likely to have pain from gastrointestinal reflux, and there was definitely a manifestation of this in those children. This is a particular child who was taking out his gut dysfunction, his abdominal pain on his dad, and inflicting wounds because of the pain he was in. So when you see aggression, self-injurious behavior, when you see OCD, anxiety, even depression, think about what's going on in my child's gut. Does he or she have gas, bloating, pain, constipation, reflux, germ overgrowth? And what causes that? So let's look first at the more specific causes and things we can do about germ overgrowth. So what affects our microbiome? What's going on within our gut? First of all, it starts before birth, but starting at birth, it really is affected by whether a mom has a vaginal or C-section delivery. It's affected by the diet. A child is more likely to have microbiota or abnormal flora if they're formula fed. And also, what's the first food we often give to children? Rice cereal, carbohydrates, fruits. These feed the abnormal flora. We're much better off starting our children on avocados and vegetables. The environment definitely affects it. Those in urban settings are more likely to have an abnormal microbiota. Those without pet exposure, abnormal microbiota. And certainly those exposed to antibiotics and hospitalized are more likely to have abnormal microbiotas. So looking specifically at C-sections, those children born by C-section are colonized with germs that more closely represent their mom's skin flora, whereas those born by vaginal delivery more closely represent the maternal, vaginal, and intestinal microbiota, and much more predominant in bifidobacteria, which is very important for the brain development of all of our children. So if your child is born by C-section, there are things you can do, and we'll get to that in a few minutes. So what do we look at if we think on history and physical exam that a child has gut issues? What do we look at? And these are reasons to go see your mind practitioners, to go to practitioners in your area, take the history and what you see on the physical exam of your child, and ask them to look at these tests that may be very helpful. One is a urine organic acid test. It's called an O test, just standing for organic acid test, or a MAP, a metabolic analysis profile. This looks at 45 different metabolic pathways, and one of the things is the metabolites of yeast and Clostridia, parasites, and bacteria, which can be very helpful in looking at the gut. You can also do stool microbiology, which is looking for bacteria, mycology, looking for fungus, and parasitology, looking for parasites. A positive test may be helpful because it'll help you know how to treat your child. But a negative test doesn't mean those germs don't exist. Sometimes they're hiding, and they can be hiding in something called a biofilm. And I'll talk about that more in a few minutes. But when we have chronic germs, our body doesn't want to get sick from it, so it'll sequester those germs in a biofilm or mucus layer, which makes it harder to treat sometimes and certainly harder for us to find it. We also look at inflammation and inflammatory markers like calprotectin and lysozymes. You can look at fecal fat, especially if your child has a problem with weight gain. You can look at breath tests for how they're absorbing certain sugars, and a breath test for SIBO. SIBO stands for small intestinal bacterial overgrowth. It can also be yeast overgrowth, but that doesn't, CO doesn't sound as good as SIBO, so we stick with SIBO. That is something that's very important to look for in our children, and I'll talk more about a little bit later also. Inflammatory markers within blood tests, just your typical blood count, SED rate, C-reactive protein, and ANA, alpha nucleic acid, which is very important in a lot of inflammatory conditions. An ammonia level in the blood can tell us that a child has dysbiosis. It can also help us to look at mitochondrial function, but it is an important blood test to do. Sometimes we can also do food panels. I don't do many food panels. You can talk to your practitioner about that, and again, I recommend it. One of the best ways to tell if your child is as sensitive to food or not is to look at your N of 1, meaning look at your child. What is my child craving? If they're craving gluten or dairy, if they're craving bananas, those things may be things you want to get out of their diet for a period of time and see if the behavior or the neurodevelopmental problem, the anxiety, depression improves. You need to remove it for at least 3 to 4 weeks, but that can be very helpful and save you a lot of money. You can also look at a celiac panel. Celiac panels look for the gluten insensitivity that is present, or gluten allergy that is present in celiac disease. But you can have gluten sensitivities and gluten intolerances without true celiac. So a normal celiac panel doesn't mean that gluten may not be a problem. And then moving forward, you can look for inflammatory bowel disease and certainly endoscopies and colonoscopies if necessary. But do go to a good practitioner. Any one of the practitioners recommended by mine would be fabulous to help you sort out which of these tests. You don't need all of them, but which of them may be helpful in figuring out what's going on with your child. So now we have the history, we have the physical exam, we have some lab tests. What do we do if our child has a gut problem? First of all, our guts need to move, so our children need to move. Exercise and activity is very important, and basic nutritional changes. So what does that mean? That means eating a fresh, unprocessed, as organic as possible, whole foods diet. As my friend Stu Friedenfeld has said, there is no such thing as junk food. It's either junk or it's food. What I'm asking you to do is feed your children food. And so that's non-barcode vegetables, proteins, good fats that help to decrease inflammation. The diet needs to be as varied and rotational as possible. Evolutionarily, we could only harvest foods at certain times. We were only meant to eat foods on a rotational basis. So doing that as much as possible is helpful. And as I said, children crave that which they're most sensitive to. So if your child craves a particular food or several foods, remove them one at a time or all together, and then replace them one at a time to see if the bad behavior, OCD, anxiety comes back. Protein. Protein is very important for the brain and for the brain health of our children. Our children need protein every 4 to 5 hours, especially at breakfast and at lunch. So that can be leftovers from the night before. It can be protein powder, a good protein powder you can find out from your practitioner, added to cereal or oatmeal. A good coconut milk, for instance, could be a very good form of protein and fat. Avoiding excitotoxins like caffeine, monosodium glutamate, dyes. And remember, MSG isn't just in Chinese food. It's also in rice, barley, brown rice proteins, malts, and a lot of other fillers, preservatives, and additives. Also avoid phenolics if your child seems sensitive to bananas, grapes, strawberries, chocolate. And give as much fermented foods, that's kefirs, fermented cabbage, sauerkraut, good fats like coconut oil, olive oil, essential fatty acids as possible. And then remember, as organic as possible. Go to the Environmental Working Group website or to the Mind website and look at the good foods that your child needs to get. And especially chicken needs to be organic. Rice needs to be avoided for the large part because all rice now has arsenic. But limit it to organic basmati rice if you need to give some. And then the other foods that are in the dirty dozen or clean 15. Dirty dozen to avoid, clean 15 that are okay. Disruptive behavior and dietary approaches. These studies are very, very old. From 1978, we knew that wheat, corn, tomatoes, sugar, mushrooms, and dairy products could increase abnormal behaviors in our children: screaming, biting, scratching, throwing. Changing your child's diet is not always easy, but it is important. And expecting more, risking more, dreaming more is what is going to help you and your child be their healthiest. So start one step at a time. Make one good change and find a practitioner to help you. So what else do we do? Probiotics. And for those children that are born by C-section, this should be started immediately. For all children, I think probiotics are very, very important. It discourages abnormal flora, it supports digestion, it produces good short-chain fatty acids, it controls inflammation, encourages the normal movement of the gut, and you need a lot of it. This isn't about just having a good yogurt. This is about having a good amount of fermented foods or a supplemental probiotic every day. Also, Saccharomyces boulardii. Saccharomyces boulardii also discourages pathogens, including Candida or yeast. It is the best natural treatment for SIBO. And using Saccharomyces boulardii is very safe. It stimulates the production of our immune system, the first line of defense. It's the skin of the lychee fruit, a natural yeast that fights against yeast and other germs. You don't want to give it at the same time that you give an antifungal or an herb, but giving it with a probiotic is very safe and can be very helpful in our children with gut dysfunction, especially those with SIBO. What else do we need to treat? Constipation. And this is one of the things that we need to treat before we do anything else. If a child is all blocked up and we throw 20 supplements in, those 20 supplements are all going to be all blocked up too. We need to get our children pooping every day. That includes good fiber. The best fiber comes from vegetables, but you could add psyllium husk, pectin, fluids. Our children need an ounce per kilogram per day of good fluids. That's not like dairy milk, cow's milk. That's water, perhaps flavored water, coconut water. Exercise, especially swimming, can be helpful. And then some supplements can be helpful. Vitamin C is very good. And you're not going to overdose your child on vitamin C. You can sometimes do very high doses. You're just going to pee out that which you don't need. Keep in mind, though, in our children with anxiety or agitation, vitamin C may exaggerate that. Magnesium is another great treatment for constipation. We get this in Epsom salts and magnesium salts that we can put in the baths of our children. Magnesium citrate is very good for calming also and for constipation. Aloe, also one of my favorites. There's a good website to look at. Keep in mind that aloe needs to be certified. If aloe tastes good, it's probably not aloe. It's probably mostly water. Aloe does come in capsules and powders that are more palatable, and you can eat it right off the plant. It's a succulent and can be very, very helpful in treating constipation. Senna, I just love the name of this tea, so I have to include it, can be very helpful in moving your bowels. Good oils, as I've mentioned, and certainly if your child is very impacted, you may need enemas. But when you're doing these things, again, talk to your practitioner about how to do them. Then we can look at natural treatments for reflux. You will see studies again and again, even on Facebook, you'll see it on the Mind Forum, treating reflux with PPIs or other anti-reflux medication can be very detrimental to our health and very detrimental to our good flora within our gut. So I always look for natural treatments for treating reflux. Baking soda in 4 ounces of water as needed can be helpful. You can also give a small amount of baking soda in some water and see how long it takes for your child to burp. If they don't burp within 3 to 5 minutes, that may mean that they need even more help with reflux than you thought, and go see a practitioner if that happens. Apple cider vinegar can be very helpful, and this is a great natural way to break up that biofilm too that I'll talk about in a minute. But it can be very helpful before meals in decreasing reflux. Aloe, a great anti-inflammatory, in addition to helping with constipation, can help with reflux. One of my favorites is licorice, which can be a great anti-inflammatory. And digestive enzymes before meals can be very helpful. Probiotics, and then other natural remedies for inflammation like slippery elm and marshmallow root. So what do we do for bacterial overgrowth? First of all, how do I know that my child may have bacterial overgrowth? If your child has a positive behavioral response to antibiotics, if they have OCD, tics, anxiety, or agitation, they may well have an overgrowth of bacteria. This can be gram-negative bacteria. It can be Clostridia, as we've talked about before, but it could be strep. And strep is something that we see with something called pandas, which I often lecture about, and you can see a lot of those online as well as on the Mind Forum. Pediatric autoimmune neuropsychiatric disorder associated with strep. This is an acute onset of negative behaviors like OCD, tics, anxiety, even eating disorders that is associated with the onset of a strep infection or after a strep infection. You can also see these same problems with Lyme and with other germs like mycoplasma, viruses, and that's called PANS, Pediatric Acute Onset Neuropsychiatric Syndrome. So the acute onset of any of these may tell you that your child has PANS or PANDAS. So if your child has an acute onset of separation anxiety after not having it, hyperactivity, urinary or sleep problems, handwriting deterioration, that deer in the headlights look, learning disabilities of an acute onset, eating disorders, or tics, think about PANS or PANDAS. Okay. How about parasites? We talked a little bit about this with the grinding, itching, biting, picking, smearing, but also keep in mind that these behaviors are worse at the full moon. And if during the full or new moon your child has any of these behaviors or an insatiable appetite, think about parasites. Always with any of these germs, you want to do probiotics and prebiotics like Saccharomyces. You can consider medications like any of those, but also natural remedies. Artemisia, pumpkin seeds, and coconut are very good natural remedies for parasites. We talked about the problems with yeast overgrowth, and those problems, like that of a drunk, can be mood swings, inappropriate laughter, the thickened nails, the sugar cravings, the spaciness, and sometimes even urinary frequency. The best form of treatment for yeast overgrowth can be Saccharomyces boulardii. It takes longer, but it can be very helpful in addition to probiotics. There are other medications like nystatin, amphotericin, and systemic medications like those listed here that you could consider with the help of a practitioner. Again, you need to find a mind practitioner to do any of these because liver and kidney function needs to be followed at least every 2 months if you're going to use a systemic antifungal. But with any of these, a rotation of herbs may also be very helpful, and we use a lot of herbs in our practice. Herbs like oil of oregano, grapefruit seed extract, caprylic acid, biocidin, berberine is found in golden seal, can be very good for strep, for instance. Plant tannins can be very good for yeast. Garlic's good for anything that ails you. And Tega is one that is from the boreal forest, and one that several mind practitioners recommended to me the last time I was in Australia, and has been very helpful for my children with strep. So think about these and a rotation of these herbs in treating your children, either with a mind practitioner or getting started before you can see one. So when you use the herbs, one of the things I look at is a biofilm protocol. So what does this mean? That means that you take that mucus layer that's surrounding your germs and break it up with an enzyme. There are lots of different enzymes on the market that you can consider with your practitioner. And then 15 to 30 minutes later, you give an herb and a rotation of herbs like the ones I just mentioned: oil of oregano, olive leaf extract, grapefruit seed extract, tega, and rotate them weekly. You also want to give, as I said with constipation, you want to give something that helps to mop up. You've broken up that biofilm, now you've got to mop it up. And that can be your fiber, pectin or psyllium husk, aloe, or magnesium. And then you also want to nourish your child with good foods, an antioxidant, anti-inflammatory diet, and nutrient support. A couple of things to keep in mind: because this mucus layer of biofilm also contains good minerals like calcium, magnesium, and zinc, you want to make sure those are given away from steps 1 and 2 of the biofilm protocol. And as with treating any of these germs, there may be some temporary die-off. Die-off is when your child gets a little bit worse before they get better. And that's something to think about. That's that good bad, meaning they get worse. That's a bad thing as a mom or a dad. But that means we are killing off the germs. Think about the germs being your enemy army. They don't want to die. They are loving life in that warm, moist environment called your gut. And you are now coming in with heavy artillery, the herbs or the medication to kill them. And you're starving them out because you've got them on a good diet that's not feeding them. Those germs don't want to die, and they may fight back with diarrhea, constipation, gas, bloating, anxiety, irritability, and pain. So keep that in mind when you start to treat and work with your practitioner. These next few slides give you more specifics on each of these steps, and I'm not going to go through that, but just know that with anything that you start in our children, start low and go slow and rotate the herbs. The fiber, as I said, is very important, and there are lots of ways to give that. All of this will be in your Mind Forum literature. This talk will be available to you. I don't want to spend a lot of time going through the specifics. One thing I do want to spend time on, remember there are lots of good anti-inflammatories on your shelf, not just the aloe, but also ginger, garlic, turmeric, okra are very soothing foods and spices that you can use. The fermented foods are very good natural probiotics. And supportive supplements like comfrey, chamomile, and colostrum. Fresh from the goat is the best way to get the colostrum, but all of those can be very helpful. And bone broth. Keep in mind you want an organic bone broth. You don't want to overdo it because you can get some excess glutamates out of that. But bone broth can be very helpful in giving good immunity and good protein to our children. And then, of course, juicing. All right. So overall, what we do for the gut is we promote immunity. We remove stressors. So we remove any foods that our children are sensitive to. In my opinion, initially, you may want to remove gluten and casein. Not that it affects all of us, but it's a very hard molecule to absorb. So if your child has gut problems, you may want to remove those foods for a period of time. You also want to remove those germs with antimicrobials if you think they're present in your child. You want to supply good nutrients through a good diet. There's as many diets as there are children these days, but considering gluten-free, casein-free, soy-free, yeast-free may be something you want to consider for a period of time for your child. You may also want to talk to your practitioner or someone at the Mind Institute looking at the specific carbohydrate diet, the body ecology diet, or certainly the GAPS diet, which is the gut and psychology syndrome diet that was written about by Natasha Campbell McBride, who is another Mind practitioner. Antioxidants like vitamin C, A, and D can be very helpful, particularly zinc and magnesium. Many of our children with gut dysfunction are deficient in both of these minerals. So look at that in your children. And if your child has white spots on their nails, if they have acne, if they have little aphthous ulcers on the side of their mouth, they may well be zinc deficient. If your child has thawing behaviors, sometimes even salt cravings, constipation, restless sleep, twitchiness, they may be magnesium deficient. So think about that. We also think about anti-inflammatories. And one that I use quite frequently is ibuprofen. And if your child particularly has tantrums, anxiety, agitation, self-injurious behavior, you may want to consider giving a dose of ibuprofen at 10 milligrams per kilogram to see if that shortens the length or severity of the tantrum or anxious behavior. That is a good sign that inflammation is part of that behavior. Giving other anti-inflammatories, again, like essential fatty acids, aloe, quercetin, resveratrol, which is why I drink my red wine. And the red wine from Australia is the highest in resveratrol. So moms and dads, at the end of the day, if you need it, you have my permission. Curcumin, which is the active ingredient in the spice turmeric, can be very helpful. And again, the marshmallow root, slippery elm, and bioflavonoids. Supplying probiotics and prebiotics that we've talked about is very important in discouraging pathogens, controlling inflammation, and encouraging good peristalsis or movement of the gut. You may need much higher doses of probiotics than you think, and work with a practitioner in deciding that. And then encouraging digestion through enzymes. So this page in one succinct slide gives us everything we may need for our children if their mood disorders are affected, are exacerbated or caused by gut problems. One of the things I'd like to mention briefly is something else that William Parker at Duke has talked about a lot, and that some practitioners are using. This is available in Australia, and you can talk to your practitioner about it. And this is that cute little guy, a helminth. Helminth is just the fancy doctor name for worm egg. And let me tell you about why a worm egg may be helpful to your ecosystem. But first, let me talk about how we can change a whole ecosystem with one element. And my analogy is when they reintroduced wolves in, I believe, 1997 into Yellowstone National Park. Yellowstone National Park is a vast area, and they introduced 14 wolves. When they introduced the wolves, which they thought was not going to be any big deal, they reduced the elk population. The elk had been eating the willows, so now there were more willows. And with more willows, there were more beavers. And with more beavers, there were more dams. And with more dams, it changed the whole stream hydrology and the whole water ecology of Yellowstone National Park's ecosystem. And so that's why when we look at us, over the past 100 years, we have depleted our ecosystems of the plethora of germs that we need. We've done it by using toilets, wearing shoes, eating processed food and water, not breastfeeding, using antibiotics, more C-sections, wearing sunscreen and working indoors, not getting enough vitamin D exposure, et cetera, et cetera. And what that has caused is a lack of our plethora of germs that we need in our microbiome. And so we enter this little dude, which we call scientifically Hymenopus diminutus cercoides. Don't ask me to say that 10 times fast, but abbreviated in HDC. Dr. Baker, my mentor, calls them premobiotics or little dudes. But the HDC is a low-cost cultivation that facilitates the normal immune system within the gut. It's not transmitted from person to person. It is intraluminal, so it's very, very rare to cause any infestation. They're raised in grain beetles, so when we used to dry our grains in large vats, we used to eat grain beetles and grain beetle worm eggs. So evolutionarily, we're used to eating these. It evokes an immune system response that we need by decreasing inflammation and increasing anti-inflammatory cytokines. Do not use this intervention if your child is constipated, has very slow motility, so it takes a few days to see the beet or charcoal that they ate, is on any immunosuppressive medications, or is nonverbal. And certainly if you do it and they get any abdominal pain, stop and ask your practitioner. But it is a very good intervention to consider and to talk to your practitioner about. And there's a website to look at to learn more information. So let's look at OCD and anxiety in a particular child. This is Samson. As you can guess, I'm going to tell you that he has a lot of gut problems. You can see that he's malnourished despite a fairly decent diet, and certainly has a lot of gut distension. He also has OCD, anxiety, and moodiness. OCD and anxiety has been shown to be related to stress. Not just stress on the outside, but oxidative stress. Stress within our adrenals, our thyroid, our glutathione metabolism. And glutathione is our major metabolite that helps us to detoxify. Children with OCD, mood disorders, anxiety, depression are more likely to have lower levels of vitamins E, C, and A, and higher levels of oxidative stress. So what can we do about that? In addition to treating the gut, we can look at things like N-acetylcysteine. This is a precursor of glutathione, a very powerful antioxidant. It's an excellent treatment for and has been studied in all kinds of compulsive behaviors, OCD behaviors, hair pulling, and generalized anxiety. The form is important. N-acetylcysteine is oxidized when it's exposed to air. So the effervescent tablets or the individual tablets that are buffered and individually packed can be most helpful for a child with OCD. There are also what we call adaptogens. These are very important in supporting our adrenals. The adrenals are what surges adrenaline, so that fight or flight response, that deer in the headlights. So when we're stressed and we get that feeling in the pit of our stomachs, our hearts are racing, that's our adrenals working. Herbal adaptogens are something that can be given as needed, and it's things like ashwagandha and rhodiola, which has been shown to be very beneficial in anxiety and depression. Ashwagandha has been comparable to fluoxetine, which is an SSRI or a medication often used for anxiety, depression, and OCD. We call it the herbal Valium. These can be very helpful in treating our kids. Other interventions to consider is hemp oil, which is the non-medicinal form of cannabis, and has been shown in mice to have anti-compulsive effects. 5-HTP is a derivative of serotonin. Serotonin is the neurotransmitter within our body that is most important in decreasing anxiety and in inducing a more happy feeling. Tryptophan was removed because of a contamination issue, but 5-HTP is very, very safe. You don't want to take it with an SSRI, but otherwise it can be very helpful in decreasing panic, anxiety, OCD, and in improving depression. Inositol in very high doses is a B vitamin that also affects serotonin and reduces OCD and panic. And lithium orotate, unlike lithium as a medication, this is a supplement that can cross the blood-brain barrier and more easily in low doses can cause mood improvement, decreases in depression and anxiety without memory loss, weight gain, or changes in your personality to a negative aspect. Other interventions to consider, certainly what we did in Samson was treated his dysbiosis. We treated him with probiotics, Saccharomyces boulardii, and a rotation of antimicrobials. We also can consider therapy. Don't forget about cognitive behavioral therapy. It has been shown to decrease abnormal metabolism in the brain. Mindfulness, meditation, you can do this. There's great videos on how to do mindfulness with your children. Exercise, swimming, karate, walking, hiking, getting outside and doing whatever you can to exercise. And then good sleep. Sleep loss amplifies problems in the amygdala, part of the brain responsible for anxiety. Sleep loss increases anxiety, and getting good sleep has been shown to decrease anxiety. And then finally, diet, as we mentioned, again and again and again. So let's look at another child to emphasize the problems that we see in the gut. Drew was a 12-year-old when I first saw him. He had a normal pregnancy. He was born healthy, but developed very severe colic. He had problems after each vaccine, had delayed speech, hyperactivity, tantrums, delayed toileting, chronic constipation, and a megacolon, which means his intestines were very swollen. And he had a severe regression right before kindergarten and was never the same again, and was diagnosed with ADHD, adjustment disorder, Asperger's, fine motor delays, and lots of emotion and conduct disorders. And he had been suffering for about 6 years when I saw him. He was tried on multiple medications, and nothing was working. So in further history, he had also had very poor sleep. So remember, poor sleep, we think about gut dysfunction. He choked intermittently and sometimes seemed to have trouble swallowing. Well, what does that sound like to you? Well, when I hear something like that, I think about reflux. I think about things getting stuck or irritated in the esophagus. And the parents wondered if food got stuck, since he would sometimes bang on his sternum. His past medical history was also significant for allergies and eczema. So that makes me think there's inflammation. Does he just have agitation and regression and self-injurious behavior because he has bad behavior, poor parenting? Or is it something else? So what we were finally able to do is get an endoscopy on this child, because I thought he had esophagitis, or very, very severe reflux. And indeed, he had esophagitis with friability and cobblestoning of the mucus, swollen glands, and submucosal hemorrhages. So we treated him. We gave him apple cider vinegar in a small amount of water before meals. We gave him lots of aloe vera juice, licorice, digestive enzymes, probiotics. And after just that treatment, he went from being a child that was very agitated and thought to have an IQ of 60 to a child that was happy, involved, and had an IQ of 150. So don't forget about the gut. These are the types of kids that have helped me travel down a different road. And I do encourage you to find a practitioner through Mind to help you travel this road. And look at the basic interventions. Heal the gut. Treat the abnormal germs. Treat the constipation. Decrease the inflammation. Avoid what harms. Maybe remove gluten and casein. Remove additives, toxins that your child may be getting too much of, and give what heals, what they need. Give the nutrients, the zinc, the magnesium, the essential fatty acids, the probiotics that your child may need. And fix underlying metabolic problems. First, with good exercise and sleep. You may need melatonin, which is another metabolite of serotonin that may be helpful, or 5-HTP. Give folinic acid, folate, which is a B vitamin that may be helpful in calming, magnesium, as we've talked about, glutathione or N-acetylcysteine, as we've talked about, and anti-inflammatory. And help your child to detoxify naturally by stooling every day and sweating every day. And in these ways, we can help our child, whether they have mood disorders, OCD, anxiety, depression, or ADHD or autism, to be the best they can be and to reach their fullest potential. So we begin by considering the individual history of each child. We look at that through history and physical exam and maybe some laboratory data with our practitioner, and figure out what each child needs that they're not getting or may need to get rid of that they have too much of. And see treatments as clinical trials with your N of 1. Your child is your N of 1, and work with your practitioner to help that child, your child, reach their fullest potential. I often say that all of our children are gifts, And it is our job as practitioners to unwrap the true gift that is inside. And your child may have several layers of wrapping paper that we need to get through. And we may need to change their diet and put them on supplements and put them on antimicrobials and get them better exercise and sleep. But don't forget as you're treating them that your child, whether they're wrapped in 9 layers of wrapping paper or we've gotten to the true gift inside, they are a gift as they are today and as they can become. Courage does not always roar. Sometimes it's the quiet voice at the end of the day saying, I will try again tomorrow. So don't give up, keep trying, and keep working with those at Mind and other practitioners who can help you help your child. Thank you.
Thank you, Dr. O'Hara. That was fantastic. We're going to take questions now. We'll be sending it through.
So one of the questions I have is, my child improved dramatically on a GAPS diet. Does that mean my child needs to stay on this diet forever? The answer is no. A GAPS diet or a specific carbohydrate diet are meant to be healing diets. What it means is that your child probably had or has inflammation. And so what you want to do is keep your child on a very healthy diet, limiting grains and carbohydrates, limiting free sugars, desserts, and lots of fruits, but to keep them on a very healthy diet going forward. Your child may need to be on a GAPS diet for several months to several years, but it should not be lifelong.
Okay, great. Do you recommend fish oil, and if so, when and what kind?
So the next question is, do I recommend fish oil? I do definitely recommend fish oils. I think if there are 2 things all of our children need to be on, it is essential fatty acids or fish oils and probiotics. The most important thing with a fish oil is to look at a good product. You want to make sure, because we're talking about fish, that there are not high levels of mercury. So you want to work with your practitioner to know you have a reputable brand. The second thing you want to look at is the type of essential fatty acids that are in there. And for little children, children less than 3, and sometimes for our most severely affected children, they need higher levels of DHA. But for older children, they need levels of EPA to DHA to GLA in a 3 to 2 to 1 ratio. And some of our very good essential fatty acids have all of that. You can find this in flax oil. You can find it in evening primrose oil. You can find it in cod liver oil. And those are all oils that I would consider and work with your practitioner to decide on dosage and type for your child.
Great. Okay. My baby keeps getting ear infections, and the pediatrician's given her several courses of antibiotics, but I keep being warned not to give antibiotics. What do I do if she gets another ear infection?
So the next question is, my baby has had multiple ear infections and put on multiple antibiotics. What can I do to avoid this with the next ear infection? So first of all, it's very important to look at the environment, both of the gut and of the child's milieu that may be affecting that child. So if your child is on dairy, I would recommend removing dairy. You can use coconut milk, almond milk, hemp milk instead. Also, other dairy products like ice cream and cheeses should be removed for at least a period of time. If there's anybody that smokes in the house, that person should be removed, or at least the smoking removed around the child. And that person's clothing should be changed before they come around the child. If the child's in a daycare situation with multiple children, that can exacerbate their risk of ear infection. And then you want to look at ways to decrease any congestion in the nose, mouth, and eustachian tube. And that can be done with enzymes. There are very good enzymes that help to break up mucus that you can discuss with your practitioner. You can also look at extra fluids and extra antioxidants like vitamin C, vitamin D, and vitamin A. And dosages of that you should look at with a practitioner. And those are all things I would consider rather than going directly to antibiotics for an ear infection. The next question is, how do I treat a teen with anxiety? So first of all, I would treat a teen in the same way that I would treat a tween or a child. I want to look at their diet. I want to look at their exercise. I want to look at their sleep. I also want to look at certain supplements that may be helpful, like the N-acetylcysteine that I mentioned, possibly the 5-HTP, possibly the hemp oil, or lithium orotate. And then I want to make sure that the child doesn't have a sudden onset of anxiety, and that could be related to PANS or PANDAS, as I mentioned. So looking at all of those things in the gut, in the sleep, in the exercise, and certainly in the diet. So the next question is, my 10-year-old is very depressed, and is it possible for a child to be depressed, and what can you do about it? Absolutely, it is possible for a child to be depressed, and I think first you have to look at what's going on around that child. You know, was this an acute onset? So again, do we look at behaviors, germs such as strep, mycoplasma, or viruses, or even Lyme disease? It is present in Australia. Could that be a cause? Then we look at, is the child getting adequate nutrition within their diet? Do they have any mineral or vitamin deficiencies that could be exacerbating this? Do they have any neurotransmitter or adrenal problems, signs of oxidative or adrenal stress? And all of those things need to be looked at or addressed. And I certainly would recommend a 10-year-old seeing a qualified practitioner and talking about all of the ways that you can treat that child with depression. The next question is, how relevant is the information that I've shared for a troubled child to the rest of the family? Do you recommend a whole family approach? Certainly as a mom, when I was treating my own son, which I don't recommend to any of you practitioners out there, but I treated the whole family. And I think, you know, most of our children are symbiotic with us as moms and as dads. And so when our child is troubled, we are troubled. And when we are stressed because of that, our child is stressed. So it is very important for the whole family to be treated. And it's very important for all of us to be on a good whole foods diet. So do think about that as you're treating your child, and do the approaches with them. Do the mindfulness, do the exercise, do the diet. It can be very helpful for everybody. The next question is, what do I think of liposomal glutathione and nanoliposomal glutathione versus the N-acetylcysteine that I recommended? What I can say is with the individually packed N-acetylcysteine, there have been 17 studies that have shown marked improvements in anxiety, OCD, compulsive behaviors, panic disorders, etc. There has not yet been that kind of research with liposomal or nanoliposomal products of glutathione. Anecdotally, many of us have had good responses, and it is certainly something we can consider, but there's just not the research behind it yet as strong as with the N-acetylcysteine. The next question is, do I recommend essential oils? Essential oils can be a nice adjunct. They can be placed on the feet or on the wrists. There are protocols for PANS and PANDAS with essential oils. There are protocols for anxiety, protocols for autism. So there are lots of essential oils you can use in a diffuser or topically that can be very good adjuncts and calming agents for a lot of our children. And I would recommend talking to one of your practitioners about that as an adjunct. Next question is, I think my child has SIBO, which we know is small intestinal bacterial overgrowth. Should I feed him fermented foods? With SIBO, it's very important to treat the bacterial overgrowth or the yeast overgrowth. And the first thing I recommend is probiotics and Saccharomyces boulardii, as I said. some children with yeast overgrowth as part of their SIBO can be very sensitive to fermented foods and probiotics. So you want to start very low with just tinctures almost, and build up slowly to a teaspoon up to an ounce a day. And that can be helpful for our children with SIBO or small intestinal yeast overgrowth. The next question is, I started my child on Nilstat, which here in the States we term nystatin, and he didn't get any better. What do I do to treat yeast? First of all, nystatin or Nilstat works directly in the gut and not systemically. So if your child has had yeast for quite a long period of time, it may be that they need something stronger or longer. I think one of the biggest mistakes we make is not using a high enough dose of something and not using it long enough. So to treat yeast, certainly probiotics, limiting sugars and sugar-related foods in the diet, including complex carbohydrates, and adding antimicrobial herbs that we talked about today, oil of oregano, grapefruit seed extract, Peau d'Arco, Tega, or medications together with your practitioner, like systemic medications like fluconazole, etc. Can fasting work to help a child with gut problems? That's a very interesting question, and one that we use a lot in the adult population. One of my colleagues from medical school actually has written a book and been on several TV programs talking about using fasting to treat gut problems. It does work in adults. It is very problematic in our children and very hard to do for a long enough period of time as a mom and as a practitioner. So we do use prolonged fasting in children without mitochondrial dysfunction. In children with mitochondrial dysfunction, that's not something that you want to use. But in children without mitochondrial dysfunction, even an overnight fast of 12 to 14 hours can be helpful. But again, you want to work with a practitioner. This is not something you want to do on your own. It's something you want to do very judiciously in children. Another question is, I thought fasting was good for mito. Unfortunately, many children with mitochondrial dysfunction cannot function, cannot move without protein every few hours. And in fact, some of the reasons some of our children get worse after surgery is not just because of the anesthesia, but because of the prolonged fasting and dehydration that may be accompanied with that. So in general, I am very cautious about fasting and mitochondrial dysfunction. Disease and different diseases may be different, but with mitochondrial dysfunction, I am very prudent with it. Next question is, are there any books you recommend? There's an excellent book on inflammation by Kelly Brogan, who has also been a Mind Forum participant. An excellent book called The Gut and Psychology Syndrome by Natasha Campbell McBride, who is also a Mind participant. There are lovely books. One of my patients, a young man, wrote a book called The Race to Recovery, which was meant for children, in showing them how to change diet and supplements to feel better. He got over his allergies and brain fog and ADD with these interventions. There are also several good books out there by Dr. Baker on how to detox safely, Syndrome X, the metabolic syndrome. Those are very good books. And there are several others I'm sure I'm forgetting and that you can find at the Mind website.